Thank you. I'm actually going to be a little bit strange here, and I'm going to present with my mask on. Personally, I just think it's an incredibly good fashion style statement and really works with my outfit, but I will try to speak clearly.
You look much more handsome and mysterious.
See, exactly. See, you understand where I'm going with this.
Please, not with the mask. Not with the mask.
I am going to explain why I am going to be presenting with my mask on during the context of my talk, because I think it is a very important point that needs to be made.
Okay, but
So as I've been walking around Rome and actually in my hometown of Chicago, there's the perception that the pandemic is almost over, that we are actually able to be here in person is a testament to that fact, that we are talking about healing, talking about recovery, shows the progress that we have made. This progress is real and is very good news, but unfortunately, it is not the complete story. The pandemic is not over, and we have very high cases in many areas of the world. Part of that is due to the number of people that are still unvaccinated, locally and globally. All of Africa is estimated to only have 4.5% fully vaccinated. Part of that is a reliance on just one measure, vaccines, which are a very potent and excellent measure, but we also have waning immunity. We have more transmissible variants. And part of that is, of course, exhaustion, that we are all tired of taking these measures. We are all tired of looking this stylish all the time. So I am here to state what nobody wants to hear, that the pandemic is not over, that we still need individual precautions, that we still need the systemic political global actions that include but are not limited to vaccines. We need to take these individual precautions to protect ourselves, but to protect those around us also. Because even if you are vaccinated, you can still transmit the virus. And we do not know, when we look around us, when we are walking on the street, who is vaccinated. We do not know who around us might have underlying health conditions that puts them at increased risk of severe or long-term disease, as I am. So we also need to create and continue taking these systemic and global political actions to ensure global vaccination, to protect against the emergence of new variants. It's very easy to make this argument ethically, saying that we have an ethical responsibility, but that often doesn't translate to action. So I will use the self-serving argument of saying we are all still at risk as long as we let the virus continue to circulate. And this is because each time the virus infects somebody, it changes. And so the more infections that we have globally, the greater the chance of an emergence of a new variant that can evade the vaccines and erase some of the progress we have made. So we need to act, and we need to act globally. But even if all of the world that was eligible was vaccinated tomorrow, even with boosters, the pandemic would not be over for everyone. We still do not have approved vaccines for young children, but children can be infected. They can transmit the virus, and nearly 10% develop long-term debilitating symptoms of long COVID. That is a disturbing statistic, but think about it in terms of the experience of being a parent with a child with long-term illness that cannot go to school, that cannot socialize and play with their friends, that you do not know how long this will last for them, what the long-term effect on that child will be, and that you cannot go and get the support that you need, because in most countries, long COVID, let alone long COVID in children, is not recognized. And there is still a false perception that children do not get ill with COVID. The pandemic would not be over for the clinically vulnerable that are immunosuppressed or immunocompromised and can't get vaccinated. Or even if they do get vaccinated, do not develop a robust immune response. These are often invisible members of our society because they have been isolating at home to protect their health, often without support, and in some areas, even facing legal action if they keep their vulnerable children at home. The pandemic would not be over for those with long COVID. As we have heard, the WHO estimates that over or nearly 133 million people have long COVID, including children. These are long-term debilitating symptoms of COVID infection, and we do not have the recognition, the awareness, and the support, including financial support, in most countries around the world. There are also many others that have suffered and are still suffering during the course of the pandemic, from economic hardships to other effects on health and well-being. So the pandemic is not over, and we still have much work to do. But how do we do that? So I propose 7 steps. First, on an individual level, we need to ensure that we continue to take the actions to protect ourselves while looking with compassion and support to protect those around us. Second, all countries, including those that are doing very well, need to continue with safety precautions for both adults and children. Masks indoors, even for people that are vaccinated, vaccine outreach, air quality, ventilation, travel regulations, asymptomatic testing. We know what to do. Third, we need to act to protect and support the vulnerable and those that are suffering. Ensure that when we think about healing, we do not leave anyone behind. This includes acknowledging long COVID for both adults and children and dedicating long-term support and resources. Fourth, we need to act globally and facilitate support for vaccine access, including the patent waiver, WHO technology transfer, COVAX donations, and funding. Fifth, we need to learn. We need to learn from this experience and better prepare for the next disaster. We know that climate change is accelerating outbreaks of new infectious diseases. It is not a matter of if there will be another pandemic. It is a matter of when. And this is, of course, occurring on top of the existing climate change disasters that we are already experiencing. And one of the critical lessons that we have learned in our work is that we need to work together at a community level, because no one is better poised to understand and respond to a crisis than the community that is experiencing it. So we need to act now and build the systems that develop and support community resiliency. Sixth, we as scientists, doctors, politicians, patients, citizens, advocates, leaders, we need to listen to each other. We need to encourage diverse voices. We need to work together to build consensus and to rebuild trust. This is a syndemic, and it touches on every aspect of life. And if we are going to recover and better prepare for the next disaster, we need to work together at a community level. And this is not just experts and leaders proposing solutions for communities.
I beg your pardon, Jeremy. Time is growing short.
Okay.
Can you please go to the conclusion?
I will. This is not just experts and leading proposing solutions for communities, but listening to and working with communities. And finally, as it has been said, we all need humility and fierce resolve. We need to admit that we do not have all the answers, and none of us has the solution. But we must have the courage and resolve to act, to put our careers, our reputations on the line to say that there is a better way and to say it over and over again. And not just to the receptive-minded audiences like we have here, but to the politicians, to the world leaders, that we keep saying it until we have the systems that protect people now, that support healing for all, and prepare our communities to weather the coming storms. Thank you.